Teen mental health crises are rising, and families can feel powerless. But what if your teen is waiting for you? A shocking 40% wish their parents would just ask how they're really doing. Your support is a literal lifeline. It measurably decreases the risk of depression and suicide. In fact, an open and accepting home can reduce a teen's stress levels by a staggering 30%. So how do you become that support system? We'll break down the communication blueprint, the home environment, and professional tools. First, it's not a conversation. It's the space you build. A predictable, emotionally safe home is the bedrock of support. This concept is so effective, it's the basis of formal support programs. They work by improving parenting skills to help adolescents. With a safe space established, the next layer is communication. It begins with showing empathy and genuine respect for their feelings. A key skill is to listen without immediately trying to fix it. This builds their own resilience, not your control. This doesn't need to be a major event. Simply asking how they feel and noticing changes is a powerful, proactive habit. But how do you make these conversations feel normal, not like an interrogation? The key to breaking the stigma at home is next. The answer is normalization. You make it normal by discussing your own emotions and stress management strategies when appropriate. This works because it reframes mental health as a normal part of life, just like physical health. It gives them a script to follow. This extends to how you handle conflict. Teens learn coping skills by observing you. Calm parents raise resilient teens. So, your actions speak louder than words. You're teaching a powerful, unspoken curriculum on how to handle life's challenges. Let's look closer at this modeling. It can start with how you speak to and about yourself. Positive self-talk is a daily skill. Don't just tell them to take a break. Let them see you go for a walk after a stressful day. These actions are the real lesson. But this modeling works both ways. Constant family conflict can set the standard in your teen's mind for unhealthy relationships. This connection can be biological. A teen's risk of developing an anxiety disorder is 6 times higher if a parent has one. And none of this is easy. A teen's crisis puts immense emotional strain on everyone, affecting the entire family's ability to function. This brings up a hard truth. You cannot pour from an empty cup. Your own mental health is a core part of the support system. So if the whole family is stressed and your own well-being is at risk, where do you turn? What does a structural solution look like? The most effective answer is to bring in a professional to help the entire family system. This is what family therapy is designed for. Recall the communication skills from earlier? Therapy provides a guided space to improve the very dynamics that may be causing friction. And leaning on your own support network is the ultimate demonstration of healthy coping. Here's the key insight. A healthy family isn't one without problems. It's one that builds safety, communicates openly, and asks for help. The evidence is clear. Families are not helpless bystanders. You are an active, powerful agent in your teenager's mental well-being. It can begin with one small step. That 40% of teens are still waiting. They want you to be the one to breach the silence. Your first step. Tonight, find a quiet moment and ask, "How are you, really?" Then, just listen without judgment. Your second step. This week, let your family see you take 30 minutes for yourself. A walk, a book, a call. Model it. Your third step. If you feel overwhelmed, look up one local family counseling resource. Just knowing it's there is a source of strength. You don't need all the answers or a perfect plan. You just have to be a present parent. You are the safe harbor in their storm. So, think about what your teen is going through. And most importantly, don't let them go through it alone. They're waiting for your support, even if they won't show it. Subscribe and sound off in the comments to share your experiences with teen mental health.